This is the Littleton Board of Health Wednesday, March 31st virtual Zoom meeting. I've checked with the town clerk, and we don't have to read that whole big long Zoom introduction anymore. But just want to let everybody know that that everybody understands the rules of Zoom. So at this point, unless it becomes an issue, we'll waive the reading of the Zoom rules at the beginning of our meetings, but we can go back to that if we find people chatting and not raising their hands and not following the rules. So that's that. That was short, nice and easy. So I guess on our agenda, we're starting out at 7 o'clock with a PFAS discussion with Littleton Light and Water. And Nick's here. And hi, Nick.
How's it going? I believe Ivan Pegasic might be on as well.
Yeah. And I just heard right before we started that you guys have all this information on LCTV too.
Well, I don't know about all this information, but we did. I sat down with Kirby maybe a couple weeks ago, and he did ask some questions, and we did maybe a 20-minute update on all the projects we're working on, including the bulk of my PFAS projects. So as always, it was great. Kirby asked a lot of good questions. LCTV does a great job. It's available through our website and also available probably through LCTV on demand.
Okay. Do you want to give us an update of what's going on?
Sure. Ivan, do you have anything to say at the beginning? You want me to jump into it?
No, jump into it. I got a couple things at the end.
Okay. Yeah, so PFAS has been relatively quiet in Littleton, probably since, trying to think now, October of 2019. We found it in Spectacle Pond well, August of 19. We were able to take Spectacle Pond offline. So it was, when we originally found it, there wasn't a lot of community outcry about the problem. Then COVID hit, and everyone started worrying about COVID and kind of forgot about PFAS, except for the water department staff who have been really working around the clock on this issue. When COVID hit in March, we were just starting to get underway with our temporary solution. So the staff worked through really tight and tough conditions to get that temporary solution up and running. Really commend them for the work that they did to get Spectacle Pond back online. The well itself, we were finding just above. I got the whole family in the kitchen right now, so you might get some background noise. And the kids not behaving too well either. So this is a great meeting. So we were finding PFAS roughly above 20 parts per trillion. So at that time, there was no standard. There was talk of a standard, and there was talk of the standard being around 20 parts per trillion enforced by the DEP. That standard did come into play. They set the open comment period for that standard, I think it was January of 2020, and then shortly after, it became a standard. So the DEP has been a great partner throughout that project. They've been giving us great guidance along the way to try to help us mitigate this issue. So where we weren't very high over the 20, the board still really wanted to support public health, and we took that source offline. When we got the temporary solution in place, and if we don't remember, that temporary solution was to dilute Spectacle Pond's water with Beaver Brook. It's a couple miles away. Beaver Brook had a lot lower concentration of PFAS in it. And we were trying to dilute that water under 20 parts per trillion, because that 20 parts per trillion is what's been targeted as the number that has a long-term impact on health for a sensitive subgroup. And that sensitive subgroup is nursing mothers, pregnant women, and toddlers under the age of 1. The DEP did just add into that sensitive subgroup immune-compromised people. So that is a new one that has shown to be impacted by long-term exposure to PFAS. It's been great to be able to dilute that. We've been relatively PFAS-free, our source water through up until now. And even now we're fine. But on April 8th, we have to take Beaver Brook offline. And that's the well that we are dilute and spec pond with. And because we're taking that offline, I don't know why I had 3 kids. That was a mistake. So
Just another night in the Lawler household.
oh, this is nuts. This is why I don't leave work. So taking that well offline won't allow us to dilute that water. We have to take that well offline because typically once or twice a year, we're doing that anyway to maintain the wells. The wells, you know, they're sucking in minerals from the ground that have an impact on the mechanical equipment that's in the ground to suck the water out. We've been able to do that to all our wells that we're using, even Spectacle Pond. So every well is ready to go for the summer, with the exception of Beaver Brook. We can't take that offline because it dilutes Spectacle Pond. We're at that point. We're at the point now we're seeing significant decline in that well that we have to take it off. If we don't take it offline for this maintenance, we run the risk of this, shutting down in the summertime. And it's much better to deal with this in a planned manner, line up the workers and line everything up so it can be done in the shortest amount of time possible.
And Nick, why this time of year about usage? You want to touch on that? Why?
Yeah. Typically from November through April are months that we see the least amount of usage. We've been getting through the other ones. We started in November, really starting to redevelop these wells. It's important to get this back up before we get to that summer peak. Our area itself's not in a drought, but it's drought all around us. So it's only a matter of time that we are once again declared drought. People don't think that because it's obviously the winter and people don't have that, in their mind. And they're not thinking of that's been dry, but it's been a relatively dry winter. Hopefully we get a wet spring. We do. It's been dry for quite a period of time now. So yeah, I mean, that's kind of the story of why we're taking Beaver Brook out. The board was very adamant that we communicate throughout this project. We had a long discussion about this mailer. It's highly possible that we don't turn Spectacle Pond on. It's highly possible that if we turn it on, the numbers could be lower than 20 parts per trillion. But what we didn't want to get into a situation where we weren't informing the public that this possibility existed, and we knew it existed. So the board encouraged this mailer, which we put together. And it's my hope that this isn't a problem. And the well should be down for 2 to 4 weeks starting on April 8th. We're going to sample throughout at Spec Pond once this well goes. We sample now. The DEP makes a sample routinely for PFAS throughout this blending solution because they're curious to make sure that it works. And it's been doing a great job. The finished water coming out of that blending pipeline's been around 10 parts per trillion. So it's been doing its job. It's been doing what the engineers thought it would do. We'll continue to take samples. The problem with PFAS is it takes the lab a long time to get us the sample results. So we could take a sample today. We won't have those results for 2 to 3 weeks. So there's no way in real time to find out if we're putting PFAS into the water. A couple of things that the board did because of that was they instituted a bottled water credit. So if you're in that sensitive subgroup, please contact our department. We're not verifying really anything. If you think you're in that subgroup and you think you need help, the board supports that, and they want to make sure people drink water in Littleton safely. It's that bottled water credit. I think it's like $20 if you have a toddler under the age of 1 a month. To buy, go out and it goes right on your bill to go out and buy bottled water. It's about $50 for an adult. So depending on your situation in your house, and the DEP has applauded that approach by the Board of Commissioners because it's really a low lift for staff. The staff is dealing with a lot of issues right now. Most communities have developed and implemented measures that are much more involved in that. So this allows the resident to go out and buy water themselves, and we're picking up that cost. The other thing is that there's a lot of private wells in that Spectacle Pond watershed, and we've been working with those private well owners to try to test their water as well. The issue with that is that, once we have those results, it's a public record, and the DEP starts to get involved. So as a resident, you really have to want to go down that path and want to know. And that's what we let the residents know when they call us. That scares some people away. Some people don't want to know, and that's fine. We're not trying to force that on anybody. But if you want to know, we give you $100 towards the $350 test, and then we also facilitate that test. We'll take the sample and we'll bring it to the lab, and then if the resident has questions about the results, we explain the results to them.
Maybe Ivan's going to talk about, is there any issue at town meetings that we all should promote too or support?
Not for PFAS. This town has supported me at about, I don't know how many of the last town meetings, and given us a lot of money, and we truly appreciate that. It's allowed us to, not just money, they support us with legislation. The community has been fantastic with this issue. We're out to bid right now on the permanent solution, which is the treatment plant at Wickham Ave. That bid opening is on April 15th. And we already went out to bid for the permanent pipeline, because that permanent solution is going to be sending water from Spec Pond to Wickham Ave. And we opened bids on that a couple of weeks ago, and that we're getting close to notice of award. And the pricing was favorable for that project, which is a good sign for the larger piece of it. So everything should be underway with construction, I'm hoping, in May and June.
Yeah, and the timeline for that, so people know that construction, we won't be done until turned on until 2023, spring of 2023, about the earliest that the new plant will be turned on.
Yeah, it's about 1.5 years build. Then there's 6 months of startup. It's a very complicated plant. It's really the first of this kind built in this area. We're one of the first communities to grapple with PFAS. We were early to the game. That helped us. We just got a $200,000 grant from the Commonwealth and DEP, and that was in support of our early efforts and transparency on this project.
Yeah, Nick's being very modest. There are other water utilities around the state that are contacting Nick. He is the trendsetter with this PFAS issue.
Yeah, I just tell him I have a great chair.
Yeah.
Does anybody have any questions for Nick or Ivan?
Of course I do, because
Go for it.
Ivan and Nick are my favorites here. No,
I'm sorry, Mike, I can't hear you.
Yeah.
yeah, I know the background noise is too great. It's all right. Yes, I appreciate you're not the Board of Health. I really appreciate the effort that your gang is going through with all the other stuff going on. There's a couple of things that you touched on that matter a great deal. First of all, because of obviously medical ethical rules, we really don't understand or don't know for sure exactly what the effect of these class of compounds are on health, except by inference and from drawing conclusions from what I would call disasters, where there's been big exposures, so-called accidental exposures. Having said that, I just wanted to know, in view of the effort that you have to put in the time lag of getting a result for determining PFAS, how does this affect? Let's assume everything works for you, that your approach works. Let's just say that eventually you get there. Do you feel that the testing facility that backs you up is adequate for the task? I know that this is tough because we don't know what dose we're talking about that makes a difference, but you wanted to detect, you're trying to read a standard, I guess, of somewhere between 20 and 10 parts per billion. So I want to know, are you confident you got the testing, access to the kind of testing technology that you need to be effective?
Yes, the labs that test us are certified to be able to produce the results that are accepted by the DEP and EPA.
I'm not talking about, no. I'm talking about time and accuracy. Okay. It is my understanding that Massachusetts, like other places, continue to use testing regimes that are not necessarily picking up the compounds that they need to. All right. I'm not saying this is always the case.
Right.
And it is also my understanding that the feds have had a program going for some time, and at least 2 labs, I think one is from North Carolina and I forget what the other one's from, maybe from California. There's some new techniques out there. I don't know if they're any good. I just want to know, have you heard anything from your sources about better testing, whether it's accuracy or faster? It's the faster that interests me for obvious reasons.
Yeah. Well, the accuracy, we don't question at all. Like I said, these labs are certified. The techniques they're using are certified. There's 20,000 compounds in the PFAS family, and they're only testing for a small piece of that, because that's the piece that has been identified to be harmful. That could change over time, but that's not really up to us to really get in the middle of. We go where the DEP tells us is a certified lab, and that's where we send it. And the time, I wish it was fast, but we're at the mercy of the labs. Yeah,
and the other reason I'm asking this question is because I think all of us understand that these compounds have, shall we say, as much as some of them can stay in the human body for up to 9 years. Long residence times. I'm not talking about serum levels. I'm talking about fat tissue and all the rest. So we have a situation in town, if I understand correctly, where it's been shall we say, a chronic exposure to PFAS for some time. Correct?
I don't know about chronic. I mean, wouldn't chronic be immediate health risk?
No. Chronic exposure, I simply mean over time. It's been
over a long period of time. PFAS, is thought to have been harmful to the human body. But we're not doctors. All we do is follow the guidance from the DEP, and they set the standard, and we remove it from the water.
No, I'm not here to question what you're doing. I'm trying to engage with my colleagues on the Board of Health to realize, and there's I'm not suggesting that we're interested in quote, invading, I don't want to use the word turf. I don't want to go into your water, if you understand what I mean. That's not my point. What I'm getting at is that there are what do you call public health issues about which the public probably should know, a little bit more about. And the reason I'm asking you this question is that you've been watching PFAS for at least 2 or 3 years, correct?
Yep.
Okay. And the origin of these compounds, at least according to your latest mailings and all the rest, still remains unclear.
Very confusing, the origins.
Yes. But my question is, on those, I don't know if you're watching, if you're detecting or trying to detect the level of PFAS in any other water, shall we say, supply sources, whether you're using them or not, but are these levels staying constant or are they fluctuating wildly? I mean, what is their characteristic? None of the ones what I'm trying to find out is it a persistent presence of these compounds? In other words, how is there constant loading is what I'm trying to find out.
Yeah, I mean, it varies, but I wouldn't say it's wild, the variation. Yeah. It's pretty consistent. And we have to test all our sources. That's a DEP requirement now. We were testing before as a requirement, but now it is. We don't have a choice. It's quarterly testing. And then there's public notice if we go over that 20 parts per trillion. I guess another point to make, Mike, I think that points more to your larger question. The technology that we're implementing at this new treatment plant, the granulated activated carbon, is a great technology to remove a lot of things from the water. So if we are to find out 5 years from now that there's other compounds that could be harmful. We're hopeful that the carbon is going to remove that. We've also made some provisions for future technologies to be implemented into this plant in case we have to design something into it to treat something else. Now, that doesn't mean that, something comes down the pipeline 5 years from now, we're set. Who knows? But we try to make as many educated decisions as we could to try to protect the water and clean the water as best we could, as we know now.
And the last thing, which is, there's nothing we can do about it, but there has already been more than one report, and it's tough going through it to get at the core to see how valid it is. But it looks as if PFAS and COVID are not good together for people. There's an exacerbation of symptoms. I'll be kind. It's almost as if the two were made for each other to make life even more miserable.
Isn't that nice, huh?
So
what is good with COVID, Mike? Right?
What is good with COVID?
I wouldn't want to have anything with
the vaccine. That's it. The vaccine is it.
Exactly. That's the only thing that's good.
That's it. That's the only thing that's good.
Yeah.
Thank you, Nick. Sorry I'm trying to put together what you're trying to do and your focus. And there is, buried, I'm sure, actually somewhere in the book of things which the Board of Health is responsible for. I'm talking about the state as well as we are, that involves water, believe it or not, whether or not it's drinkable. And I'm not raising the question, in other words, is it safe to drink? And I'm not, interested in raising, it's not the question whether or not the water is safe or not. The question is making sure that we have, that the public understands very clearly what the health issues are. That's it.
Yeah, no, we appreciate that, and we appreciate the support of the Board of Health, and that is the question: is the water safe? We ask that question all the time, so no follow there. A couple of things on that, Mike. We have a PFAS webpage, so with all our information, so the public can feel free to go there for it. With it is going back to that source identification. Our staff has been working very hard along with the DEP to try to figure out where this is coming from. It just seems like there's a lot of little, infiltrations in a lot of different areas. It's not clear. We did get involved in a multi-state lawsuit down in South Carolina going after the manufacturers. So we are working diligently to try to find the source, but also get funding. I mean, this is a huge impact on water rates.
Yeah, not to mention, we're still looking at the federal level too.
Yep.
Through our representatives for potential relief on this as well.
What?
Who's that? Okay. Ivan, did you have something else to add?
No, the only thing I was going to add at the end was Nick touched upon the drought situation. While he said all around us in drought, we're not in a drought. I consider us in a drought. I disagree.
We could be tomorrow.
Yeah, I disagree a little bit with him, but the numbers that we've been tracking for the last year are not where we want them to be. So we're going to have to revisit private wells again. Okay, that's not going away. I know you guys are looking at some different things, and you're in the midst of some changes potentially and whatnot. But at some point, we're going to have to come back and revisit regulating, enforcing usage with private wells.
Yep. We'll revisit that. You guys help probably write mailing lists and contacts and things like that.
Yep. Not to add more on your plate, but
pile it on.
Right.
We're in a pandemic. Just pile it on.
Yeah.
All right. So we do have Jim for just a few more minutes. So does anybody have any quick questions for Nick or Ivan? Because Jim can't stay for the whole meeting, so I just want to get him on this variance and short little COVID update if he has time. All right. Go ahead, Kevin.
Nick, I was just wondering, do you know when we'll know if we have to bring Spec Pond offline back online?
Yeah, I'll know, but we're going to try to notify the public as best we can. It's going to be hard because it could be, I could be getting a phone call, it says in an hour we need to turn it back on, turn it on. So I would I'm preparing the residents to act as if it's being turned on. And if there's concerns, call our office and we're more than happy to talk with you and work with you. But yeah, we're going to, using Facebook, our website, we're going to notify when things are happening throughout the project.
Okay, great. Anybody else? All right. Thanks, guys.
All right, thank you.
Thank you.
Thanks. So we're gonna move on to the, I don't know if you guys saw Ted's emails going around. I guess there was a part of the variance request that he didn't see Jim's comments to. So he wants to add an additional request to allow an impervious barrier to 83 Mill Road. So Dave, if you can get Ted up, and Jim, do you have do you want to give us a brief update?
Did you want Ted to go ahead?
Yeah. Yes.
Hi, how's everyone doing?
Good.
Yeah, so this
Who
was
wants to go
on the
first?
plan last time. What's that? Yeah, so this was on the plan last time when we had the variances. It's on the plan that you approved. It just wasn't listed as a specific request. So I'm just asking to add that into the approval that you made last time. I'm sorry to take up your time. This is like the third hearing on this property. Granted, it's a difficult property, but these last two have been just things I missed. I'm going through a growing process here and I need to, I'm starting to work on spreading my work out and not getting so overloaded so that these things don't happen. So I apologize. Hopefully it doesn't happen again.
Okay. Ted, can you share your screen? And Jim, do you can you make a comment?
Sure.
Yeah.
So,
What? No?
Yeah, I can. Let me just get it up.
Ted,
I wasn't ready for it.
Yeah, you're breaking up a little bit, Ted. So if you have to repeat yourself, that's why. Go ahead, Jim. Sorry.
so on this plan here, because we had a very small part of the lot that was actually acceptable for doing the septic system, and because it slopes a little bit, to try to make the grading all work the way it should on the site, Ted had put in a small barrier, like 5 feet off the lowest trench to make sure that we could meet the breakout. The soil is really good there. This really is the only spot on the site that it can go. So I don't really have a problem with the use of the barrier. Again, the soil is really good, so you really shouldn't need the barrier, but it helps meet the breakout right there. So I'd have to put additional fill on the site.
I could share if you want.
That'd be great.
So, if you remember, here's Mill Road up here. Here's the end. 495 is over on this point. We have this driveway coming down, this looping driveway to this house here. The pond is here, Mill Pond, and the existing system's in this area, and we're trying to pump it. We're going to pump it up into here into some trenches, and right here is where we need the barrier. The buyer and the owner want to keep this shed right here. So, I mean, try to, that's the main reason to try to just accommodate everybody's requests.
And Jim, you're okay with all this?
Yeah, like I said, based on the soil quality and given that's the only spot on the site that's going to work, I don't have an issue with it.
Okay. Any members have any questions for Ted or Jim?
Jim, I have a question. Did you get to the other variances? Are you ready to approve the plan with those other edits I made?
Which plan are you talking about? This plan?
Yeah, I dropped it off, I think on Monday. I don't know if you had a chance to look at it. Yeah, you had the thing about the grading and the something else. It was something else. Oh, and raising the D box to meet all trenches. So I don't know if you got to it all by now.
I did. I think we still have to get that D box up just a little bit more to hit that higher trench, but otherwise, yeah, the rest of the changes were okay.
Okay.
Yep.
I have one more question for you. Unrelated to this.
Can you ask him another time? Because we're running, he's limited on time. He's got a COVID update to do. And I'm not sure
Okay.
how much time we'll have with Jim.
Yeah, it's okay.
Okay. Kevin, you had a question?
Yeah, are you requesting a groundwater offset?
No, we actually met groundwater on this.
Okay, because I had read you needed a 1 foot.
Originally on the plan, we had requested it, but all the, I can share again, all the trenches meet it now. On the original plan, and then the second revision or the first revision, we got away from that because we went down and we dug additional holes to prove that we had enough soil.
Cool.
Louise or Mike, do you guys have questions?
I just want to know if we're about to, I understand that Jim has said okay to a barrier, but the other components mentioned are not included in tonight's vote. Is that, or consideration, is that correct?
We have already voted on it before.
Oh, then what is Ted referring to when he talks about other things that were not included? I just want to get it straight because I understood this was the only addition that was
Yeah.
necessary
No.
or requested.
Jim had additional comments on the plan that did not require to be brought for the board. He just wanted some clarification as far as the grading over the septic tank and the pump chamber. And then he had one invert elevation on the D box that he wanted to make sure was appropriate. So nothing related that needs board approval, just something that needs confirmation from Jim.
Okay.
I'll make a motion to approve the impervious barrier for 83 Mill Road.
A second.
Thanks, Mike. We'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Selden, yes.
and Lisa Flanagan, yes. Last time, Ted.
Yeah, I hope so. Until the next project. Thanks so much. Have a good night.
All right, take it easy.
Good.
And thanks, Jim, for got a few minutes to do a COVID update for us?
Absolutely.
Okay.
So I just want to start with the numbers, and this isn't news to anybody. If you're watching the news, the numbers are going up. I guess I wanted to put into a little bit of local context. So if we go back, we get the reports from the state, and I just want to kind of give you the weekly numbers as we've had them. But for the week of that ended March 6th, there were 14 cases in town. The week of the 13th, there were 16 cases. Though the week of the 20th, there were 22 cases. And this week, so far, there's 9 cases. So I never know if that number this week is actually which way it's headed, higher or lower, because at least one of the days or 2 of the days this week, we had like 4 cases at a single address. So sometimes you get a whole bunch of people in one household and it kind of jumps the numbers quick. So it is up from the beginning of the month, like the rest of the state numbers are. I think the 2-week rolling was about the same as it was last week. I think it was 22 or 23. So that number is, the 2 weeks kind of average, smooth out the bumps. So we're watching it. I don't know if it's variants. I don't know if it's open society or there's more people who think they're vaccinated or there are more vaccinated people, so there's less concerns. Which kind of leads me into kind of my next piece of it. There is a site on the the DPH website that talks about, on the main page, what you can do once you're vaccinated. And it kind of goes through the recommendations that have come through CDC. I think probably what's most important is the things that you still should do if you're vaccinated. And they talk about what people should do, even if they're vaccinated, taking precautions in public, wearing a mask, practicing the social distancing and the other protective measures, avoiding large gatherings, wearing a mask whenever you're out in public, and getting tested if you experience symptoms. And so those things are still really important, even though we have lots and lots of people who are vaccinated out there. If people want to kind of take a look at where CDC is coming from with some of these recommendations, if you Google Science Brief CDC, it'll bring you to their page where they actually give you kind of a nice, it's a very readable discussion, starts with key points about why they're making the recommendations they're making. And so the key point sections are talking about, they're talking about the preliminary evidence that the current vaccines may provide protection against various strains, various variants that are out there. But again, there's still more research that needs to be done. They talk about things like growing bodies of evidence. So again, they're kind of hedging a bit, and that's why it's important to still be wearing the mask and doing the distancing. And they're still suggesting that preventative measures like the distancing and the masks are going to be important because of things like the variants and because not everyone's vaccinated. And because at this point, a portion of the population can't be vaccinated, although Pfizer had some good news today about the vaccine in children. So hopefully that may change soon. So I guess it's a very long-winded way of saying we shouldn't let our guards down. The state hasn't changed the mask order, so that mask order that was put into in effect, I think November, is still in effect. That requires masks in public. I don't know if that'll change anytime soon. The gathering order has lightened up a bit for public places, not private residences. Those numbers are still 10 inside, 25 outside. So again, it's important to be maintaining the mask distancing and limiting the groups. One thing I did want to mention, we got a little bit of word, the Board of Health got a little bit of word about the homebound vaccine program this week. It sounds like we should be getting vaccine at some point in time shortly. So we have been taking intake names and putting people on the list and calling them and making sure they are eligible based on the state's criteria. So we will start doing homebound visits in the district in a short while. And our office will call people back to set up appointments for that. I've had a request from the library, two kind of requests. One is, I guess, sounds like getting in preparation for their book fair, where they're, I guess they want to have National Honor Society volunteers come and essentially unload people's cars of books so that they can be stored on site. And that one, I think, is the 10th of April. And then they want to talk about the book fair itself. I don't really see an issue with the unloading of books from the National Honor Society. I don't know if the board has any particular concerns. Sounds like the car will drive up. They'll have students masked and take the books out, put them on a table. Then somebody will put them in the container that's on site. So it seems pretty low risk. The book fair or the books, it's a fair or sale, that probably needs a little bit more thinking. So it fits within the state's indoor-outdoor event guidelines, and I'll provide the library director with that information.
Thank you, Jim. Thanks for doing that. Did you see the Donlin, the letter about the was that last week?
Yep, I went down and talked to them. The person, I guess, I talked to the manager. It's been an ongoing issue. Person has a job in which they really, it's important that they see so they don't cut fingers off and stuff like that. And so their glasses fog up. And so I suggested that see if they could try a number of different things like gaiters or other kinds of masks that may have a tendency to less fog, but still get the job done. So we have had that conversation.
Thank you.
Yep.
Can I ask you a question?
Of course, Mike.
Okay. I'm trying to reconcile the fact that not only are the national numbers going up, but the numbers all around us, not just Littleton's, are going up.
Yep.
So Littleton doesn't live in this nice little bubble. I mean, we're a pass-through town as well as a place. So what I'm trying to get is what can we actually do in the face of what we'll call the current phase rules, which allow certain kinds of activities that are absolutely contradicted by what the data show. In other words, it's really not safe for having, events where people are right next to each other or playing basketball or, much of anything that's what we'll call team sport kind of stuff, especially unsupervised. So, loosely supervised. So I'm not so much interested in coming down with some more regulations, but there's a real disconnect at this point, because anytime we see these rises, and that's what we're seeing around here, it's not trivial. Even not enough people are vaccinated quite yet. We're close, probably within a month of it, or maybe less. So can we as a town, shall we say, be a little bit more restrictive or at least ask people or strongly recommend, if not mandate, certain activities not to be pursued?
So there are communities, and again, I heard them on the radio today. Somerville was relaxing some of their standards, and they're still kind of, they're not up to the state's phasing yet. They're still somewhat behind the state phasing. They did that under a public health order, which gave them the authority to restrict certain things and to allow them to open things up as they go along. And I think we've had this conversation before. If that's what you thought you'd like to do, I could certainly get some information about how you would craft that. And go forward with it. But that would be up to the board to make that decision.
Yeah, I understand. I just want to repeat. I'm asking you to repeat it because it's very concerning, especially given the fact that we're so close, as it were, in a couple of months to hopefully to getting a real control over the situation. So
no, and part of it is, and that the frustration people have when you talk to them that have contracted the disease, they're like, I think I've done the right things. And it's like, well, sometimes you just don't know who that person in front of you is. Somebody could be asymptomatic. It could be, it's just, it's just an unknown that and so those public health practices, that's why they're so important, because you just don't know. And it's not that you're trying to be rude, or it's not that you're scared or something like that. It's more that you're trying to be protective of yourself, your family, and by doing that, hopefully protecting the community at the same time.
Okay. Does anybody have any questions for Jim?
Mike, did you get your question answered?
Yeah. Mike, do you want to start rolling back Littleton's openings and things like that?
No, I don't. I certainly don't want to do anything to spoil people's fun or life here. It's just that there's a contradiction between the numbers and what I think Jim and everyone else around this table, the virtual table, sees every day, whether it's traffic, street walk, out in the street, in stores, doesn't matter where you go, even if you're, quote, vaccinated and wearing a mask. I mean, you still see stuff. And, it's, and the other piece, of course, that I don't know if this is going to jolt anyone, but Johnson & Johnson just lost 1 million doses due to what we'll call human error. It doesn't affect what we already have, but what they were, as it were, making. So I noticed that the governor announced that he was getting, or we were going to have in Massachusetts, another 100,000 doses of J&J vaccine. I hope that our allotment isn't included and wasn't back ordered. Let's put it that way.
Yeah.
Hopefully it's in state already, you mean?
Yeah, I hope so. Yeah, that's the safest place for it at the moment, is right here.
Yeah. We're hoping too, because that's the stuff that we're going to be using for the homebound.
Yep.
Yeah. Good. And
Thanks, Jim.
any more word on whether or not, they keep talking about local boards of health. Have you heard anything more about you guys getting anything to do some more local vaccine clinics?
So the state rep, my understanding is state rep's still working on it. We gave the person who's kind of heading up that plan for the state rep some additional information at the beginning of the week. We just haven't heard. I guess we haven't heard yet. And the other thing we have heard is that there may be, because of the vaccine shortage, there may be some approved regional collaboratives that aren't getting vaccine because they just don't have it to give to them. So they're trying really not to spread it out thin. So even if approved, it may be time before you get vaccine. And to Mike's point, hopefully there's no more human errors, because that'll affect the supply coming into the state. I guess the good news, based on DPH's presentation on Tuesday, they seem to be sending more vaccine to the federal pharmacy programs. So if you look at the last week of data that they showed us, the state's allocations from the federal governments were going up slightly. In the last week, the pharmacy program was going up significantly. So I don't know if that's going to continue. So for those people looking for vaccines, you may find more availability at the CVS's, Walgreens of the world.
Yeah, I've been hearing a lot of that.
Yep.
Yeah. All right. Does anybody else have any questions for Jim? All right. Thanks so much for taking time to be with us tonight.
Alrighty. Good to see you all. Good night.
Yep. Stay well. All right. Hi, Katrina.
Hey, Jim did all the good stuff. I'm done. Just kidding.
Why, you only have bad stuff?
He hit the major points. I'm assuming you see my slides. I had a little trouble with this. My computer updated at school committee and I was showing something else. So it is the front page, right?
Yep, looks like it.
Thank you. All right. So as Jim said, cases are definitely on the rise. Test positivity is on the rise. Hospitalizations are starting to head back up and deaths have completely flattened. Let's go a little bit deeper just because we are at Board of Health. So the good news is that our testing is still stable from what we've been doing. Like Massachusetts has been doing a lot of testing and that level has not dropped over past weeks like it has elsewhere in the United States. So this is a great sign. But our test positivity, so the number of positive tests over the total number of tests conducted in a 2-week, or this is a 7-day average, has started to go up. So this week it is 2.53%. Last week when I presented to you, it was 2.21%. 2 weeks ago was 1.8%. So we are definitely heading up and have been for a few weeks. And when you take out that college testing level, remember how the lines were very different. So when you take out the college testing, which is just doing a lot more testing, the state percentage is 4.3% for the rest of us. So we're approaching that 5% threshold where things kind of start to spread more quickly. And then if you look at the test positivity by age group, you can actually see that the 70 and 80 year old crew, 80 and above crew are actually trending down for test positivity, which is awesome because these are people we've prioritized for vaccine to date. You're starting to see the same kind of hint with the 60 to 69 crew, which is great because half of that group is eligible right now, or they're all eligible right now. And then the other end of the spectrum, when you look at the young under 30s, we're going the wrong way. That test positivity has actually crept up over the last couple months. So we don't know how many tests are done per age group. So this is a little hard to interpret, but this is not something that we're not liking to see this trend, this upward trend. We like to see this on the lower, the higher age groups. So like test positivity, the number of daily cases has been increasing. You can see from the graph, the 7-day rate of new confirmed cases has increased to about 1,900 a day, an average of. That's about a 35% increase over the last couple of weeks. And the 14-day statewide incidence rate is now 25.6, whereas last week it was 21.5 per 100,000. So that's a jump, a larger jump than it had been week to week beforehand. About half of the new cases new active cases in the state are people less than 30 years old. And then I put the color-coded map on this week because you can see that there's an outbreak happening. Various towns are in the red, but there's an actual active outbreak happening on the Cape. And I note this one because the Cape actually has the largest proportion of the county's population vaccinated. They're like leading the state in terms of number of people vaccinated, but they're still having a large outbreak in people who are unvaccinated. So the vaccinations to date have been the older age groups and the outbreaks happening in school age people and their families. So we're not out of the woods yet. These outbreaks can happen among people who are not vaccinated, and groups of people who aren't vaccinated tend to be socialized together, do things together. So that's how things are going to keep spreading for a little bit longer. So these are the 2 lagging indicators, hospitalizations and deaths. So one concerning thing that turned this week is that our number of hospitalizations, that 7-day average, started to increase. There's about 650 hospitalizations a day now, reported a day, and that's where we were just after Thanksgiving, or just about Thanksgiving. The good news is the average age of these hospitalized patients has decreased. At the peak in January, the average age was 73, and we're now at 64, and that's in part because of vaccination. But The hospital capacity remains at similar levels that they've maintained it for weeks. So 85% of hospital beds and 76% of ICU beds are occupied. And the number of deaths remains steady. So it's still a 30 deaths per day being reported, and that hasn't declined in 2 weeks. So we've been flat now for deaths. So while the hope is that as more people are vaccinated and we've prioritized the older age group, the more vulnerable age groups, the more we're hoping this doesn't happen, that this doesn't spike back up, the deaths and the hospitalization. But if there is a surge, there's a likelihood that these will both be under pressure again. So speaking of hope, this is the vaccination report from last week's report. So we're already 7 days behind, and the things are looking good. So last week we crossed the 1 million mark for total individuals who were fully vaccinated in the state. So that was 16% of the state's population. And as of yesterday's report, it looks like 3.5 million people in Massachusetts have received at least one dose. So at least partially vaccinated. And that's about 50% of our population, which is excellent progress. And so tomorrow's weekly report will come out with the full details about how many of those are fully vaccinated and partially vaccinated. So more details will be released tomorrow. And then Middlesex County is about 16% fully vaccinated. And it varies across the state depending on which county you're in. So if we go into Littleton, Littleton had 20, this is the data from last week's Dph report. So the one that's released for town level on Thursdays. So for the period of March 7th to the 20th, Littleton had 22 cases. The 2 weeks prior to that, we had 17 cases. So we had a slight increase, but we were still in the yellow. So 5 weeks in the yellow as of last Thursday. When we look at the rates so that we can compare rate per 100,000, so we can compare it to other areas around us, Littleton's rate was 16.1 per 100,000. And like the case count, this was slightly higher compared to the 2 week prior weeks. Middlesex County and the state were everywhere is actually slightly trending higher when you looked at the rate. So everything kind of started to turn upwards last week. And then this is the test positivity. And just like the number of cases, we actually held steady for the number of tests. We had about 1,200 tests, but our test positivity last week was 1.77, which was higher compared to the 2 weeks prior to that. And then everywhere that we've been tracking, all of our area, our local area, the region, county, and the state were all trending higher last week. And then when we look at the sneak peek that Jim shared earlier, this week we had 22 cases reported. 2 weeks ago, so Jim compared it to last week, which we also had 22 cases. The problem is those periods overlap. So which is why I go back 2 weeks, because those are two distinct groups of people. And I don't have to worry about whether I'm double comparing who's in which bucket. So for the 2 weeks prior to this, we had 21. So we are still holding flat at this point, and in the yellow. So Jim actually, when he sends Mike the email, he sends it for all of the towns under the Neshoba associated region. And when I looked at the total and all of those, every week I total them just to see what's happening as like a regional estimate to see if I can see which way we're going. 2 weeks ago, the total was 110 cases, and this week is 159 cases. So again, it fits with the state's increasing cases. We're seeing it locally and around our area as well. So we now get town level vaccination data, which is interesting. This gets released on Thursdays. So like we just saw on the previous slide, their goal is to keep Littleton in the yellow. Like I don't think we're going to get back to the green for a while, but if we can keep it in that yellow zone or below, we're holding steady, right? And especially trying to keep it there while we roll vaccines out as rapidly as possible. So this data comes from that weekly Dph report on vaccinations. And the good news is that as of last week, 29% of Littleton's population had received at least one dose, was at least partially vaccinated, compared to 24% the week before. So that was a 5% increase. Of the 29%, 15% were actually fully vaccinated. And then when you look at it by age group, you can see that we have a higher proportion of individuals in the 75 plus years and the 65 to 74 years that are at least partially vaccinated. So that 72% of Littleton's residents 65 and older have received at least one vaccine, and of those 35% are actually fully vaccinated. But that does mean there's like 500 older individuals in town who have yet to access vaccine, whether that's by choice or if they have barriers to access that they need help with. So hopefully this homebound vaccination program helps. If there's any other, if someone needs assistance with computers, things like that, I'm not sure why these people are still waiting for vaccine. So if we also look at the younger age group, if you look at people age 20 to 64, about 28% of residents in those age brackets have actually had at least one dose, and of those 13% are vaccinated. So that fits with the state's numbers as well. So we're very similar to state on the rate of vaccination. So just to summarize all the local data, cases and test positivity are both increasing locally and in our area and across the state. Looking at the lagging indicators, the hospitalization rates have started to increase, the death rates have flattened. Vaccinations continue to roll out in ways that are very nice to see. They're kind of starting to gain some speed. 29% have at least one dose, and of those, 14% have been fully vaccinated. So this is really excellent progress in terms of vaccines, but it still means that nearly half of our residents have not had access to vaccines yet. We have no vaccinations for them. And so there's still a lot of people in town who are susceptible to infection at this point. So jumping into some school data, over the last 4 weeks, Littleton's had 5 weeks, Littleton's had 1 to 2 cases reported with the health notification letters. And those have all come from the traditional symptomatic or close contact testing process. So far this week, Monday and Tuesday, we've had two cases reported this week. However, as of last week's pooled testing program, which was the last week of the hybrid model for school, there had been no positive pools, which is really encouraging as the schools start looking to open up this week they started and come back, like majority of the students are back for 5-day school for kindergarten to 8th grade. So it was really nice to see that there was no spread in the school under the old model and during a time when our town was in the yellow or declining rate. So let's just hope that continues as we open our schools back up. So backing up to some things we all should be aware of is we have to remember these variants are present, and that a number of them have been shown to be more contagious, to confer more severe disease, or may even evade our vaccines or our natural immunity and treatments that we have developed for COVID. So one in particular, the B117 is the UK variant, and you can see these are 2-week periods. You can see 2-week period over 2-week period, the B117 UK variant doubles. So this last report, this is from the CDC. As of mid-March, the UK variant was about 30% of the circulating virus that was out there being measured. And then I was listening to the governor's press conference yesterday, and he reported that one of the hospitals in Boston that participates heavily in this genetic sequencing program reported that locally we have a 55% UK variant now. So that fits with the 30. If it doubles, 60 would be right about now. So the variants are here, and the proportion of new infections that are this UK variant is expanding rapidly. Where exponential growth, when it takes off, it takes off. And I think that we're seeing some of this effects with, the outbreak on the Cape and some of the local clusters that are starting to show up. So this is an important thing to keep in mind as we move forward. So there's a lot of great things with vaccinations to report. And the vaccines are how we're going to get out of this pandemic. But given the recent rise in cases, the hospitalizations, the deaths, the presence of variants, this is not the time to relax and stop using masks and social distancing, all the things that we know work. So like I just said, like whenever there's exponential growth in the past, we saw surges of cases, then followed a few weeks later by sharp increases in hospitalizations and deaths. And the hope is that having prioritized older and more vulnerable individuals with the vaccination program, that we can blunt the number of hospitalizations and deaths. But even with this at surge, and especially for overwhelming hospital services, and you can really lead to more severe cases and outcomes. So it's not just hospitalizations and deaths that matter as well. COVID's also been associated with some long-term health issues that can impact quality of life and function. So there's a lot of reason to try to prevent disease at this point, especially since we're a few weeks away from, we're a month away from things really looking different in terms of vaccination. And we're seeing this in Massachusetts. You can see the effect of more spread with half the new cases being young people. Like, it's happening. There's also examples in Michigan and other states in the country, and also across Europe, that the highest proportion of cases are among younger age groups who before thought to be not a big deal, and have therefore not been prioritized for vaccines. So, with things opening up, businesses opening up, I think we get the sense of things are fine. The really great news about the vaccines, things are, happy, spring's happening. It makes us feel like things are reawakening, right? But this is not the time to get relaxed. Plus, with all these things opening up, we're actually more exposed now. We're mixing more than ever, even if we don't think we are, just because we have more contacts, and those people have more contacts. So we are at the tipping point right now, between getting shots in arms and the spread of variants of concern. So the question is, which is going to get ahead first? And like I said, the majority of people in our town haven't had a chance to access vaccines yet. So we just need to keep going with the layers of cheese. So a few things, just reminders, like Easter's this weekend. If you're gathering with people from outside your household, keep using those layers of cheese, those masks, opening the windows, doors, going outside, getting tested before you're gathering, following the travel advisory, limiting your group size. The more layers you use, the less likely there'll be transmission at your gathering among your loved ones. Another great way to keep COVID out of schools and workplaces and other gatherings is that if you have symptoms, or if you have a known exposure, to not go, so to quarantine and go get tested. So I know a lot of people have started talking about allergies right now, that they're starting to feel the effects of spring coming. So if you suffer from seasonal allergies, it's probably a good time to go talk to your doctor as well about, getting an allergy medicine, or what you can do to help get your allergies under control, so you know that it's not COVID. We went through this last year as well. So the other big thing you can do is get tested. So if you don't feel well, go get tested. One thing, there's the school, and they have the pooled testing thing to help us find asymptomatic or pre-symptomatic spread if it's happening in the schools. That is not for if your kid doesn't feel well and you want to go get them testing route. Keep them out of the schools and take them to a state site. And then those state sites are still running. The governor extended the funding for those through at least the end of June at this point. So they're still up and going. Go visit the website to find them. But it's free, and the turnaround is like 24 hours now versus when, the last fall it was taking a few days. So they're getting it back quicker. So when you're in doubt, go seek testing at one of those state sites. And by doing that, you will all be better off, because we're just not introducing COVID to the locations we're hanging out. Of course, mask order is still in place. We know masks have been shown to be efficacious. If you can improve the quality of your mask, either by doubling up or getting a better mask, or making sure the fit's good so you're not having leaks around the edge of it, they protect you and they also protect others. So let's just keep this going. And the mask is important even if you're vaccinated. So part of the CDC guidance on what you can do when you're vaccinated is that if you're with one unvaccinated family, you can not wear a mask, like you're limiting your group. But when you're in public or you're within multiple unvaccinated groups of people, you really should be wearing your mask. And at this point in time, when we're having so much trouble trying to keep the cases down, it's just really good role modeling for your kids and other people around you, just to keep wearing your mask for a little bit longer until the state tells us it's okay with our mask order. And then the last thing, and one of the most critical things we can do, is to go get vaccinated when it's our turn. So next Monday, individuals 55 plus and those with one certain medical condition can start to seek appointments for vaccinations. And then finally, on April 19th, on Patriots Day, the rest of us 16 and plus can start become eligible for appointments. So it is still expected, given supply issues, to take a few weeks to get into appointments. So just keep trying. But there is some recent good news about increases of supply, and then this J&J thing just dropped too. So we'll see how things keep going. Hopefully it will just keep increasing so that the speed of the vaccination program can outpace the variants. And the data on vaccines keep continuing to roll out and suggesting that not only are the vaccines protective against severe disease and hospitalization and death, but they also significantly reduce the spread of COVID out there in the real world. So the current evidence also suggests that authorized vaccines should be effective against the variants, especially the UK variant. So this is really important for us to get vaccinated as soon as we can. And then data out of Israel is actually showing that with enough eligible people getting vaccinated, there's actually a reduction in cases in people who are not eligible, such as children. So even with the UK variant circulating. So there's a lot of great ways. If all of us adults get vaccinated, we'll make it easier for our kids who are not eligible to be vaccinated yet. Although Pfizer did release some great news about the 12 to 15-year-old group, their results from their trial. So hopefully that will turn around soon. The other thing is these vaccines have been in millions of people at this point, and they're safe and they know what the side effects are and people are watching for those. But the biggest side effects are those that you would expect as your immune system's ramping up and learning how to fight COVID. So you might have those 24 hours of discomfort, but then your body is better prepared to fight COVID if it meets it in the wild, if you will. So getting vaccinated is going to help protect our town. It's going to help prevent our individuals. It's going to help prevent COVID from getting into households and offices and schools. It's just going to really help to slow down the spread of COVID and help end this pandemic. So as I end tonight's presentation, I really want to reiterate that we are at a critical juncture right now. And vaccines are our way out of this pandemic, but population level vaccine effects are like a sliding scale. So it's not a light switch. It's not on off. It's the more people get vaccinated, the more the impact will be over time. So it's going to be a sliding scale. So in a month or so, with increasing numbers of people getting vaccinated, we should really start to see reductions in transmission. So these vaccines really give us hope. But at the same time, we need to recognize that the majority of us have not, and some majority of us and our neighbors and people around us haven't had the chance to be vaccinated yet. And we're anxiously awaiting our turn and hoping that we don't get sick beforehand. So therefore, we as individuals and as a community are still susceptible. And if we have a surge now, we're going to just give COVID a chance to mutate and to do something different that might impact vaccine efficacy or treatments, or get really good at infecting certain groups of people that we would prefer it doesn't do that. So those are all things that are possible, and we don't want to give it a chance to do that. So, and also the more cases we have surge now, the longer it takes to get back to normal. It's just going to take a long time for those population level vaccine effects to get working. And that's why it's really important at this point in time that we just keep doing everything we can do to protect and prevent spread. So get vaccinated and keep using those masks and keeping distance and doing all the layers of cheese. And it's critical to keep doing this every single time you leave the house right now. So these behaviors not only protect you as an individual, but they protect all of us. And if we can work together right now, we can really see the light at the end of the tunnel much sooner than if the surge kind of takes over. So, yeah.
Thanks, Katrina. I think you echo the same sentiments as the CDC director yesterday, who was in tears telling people to just a little bit longer, hold on.
I know, it's like, can we just all have a chance first?
I'll just listen. I mean, we've been doing it for a year. What's another month? I have a question, and it may not even be something that you can do. It might have to be something that Jim might need. You might need information on, Jim. With the state reopenings, are there any surges that you're noticing? You know, like Mike talked about things opening up and, cases going up. Do you find, I know we've talked about holidays and vacation and school vacations and then a spike after that, but what about the state reopenings? Have you seen?
Yeah, so I think the timing of these increases in cases are just reminiscent of what we've seen every single time that like the restrictions relax or reopen again. We move back a phase.
We've never gone back.
Well, like, in the fall we went back to, or like just Christmas time, we went back to phase 2, phase 3, whatever that was.
Yeah, with the curfew and all that. Yeah.
Yeah. So when we reopened in the beginning, we reopened and relaxed that back to phase 3, whatever we were, which increased capacity limits of restaurants. There's some larger gatherings in public places, things like that. So predictably, 3 weeks later, we started seeing our cases rise again. And there's a CDC study on this too, that, about 3 weeks after you relax your restrictions, you start seeing your cases go back up. And then 3 weeks after that, you start seeing your hospitalizations go back up significantly. So we not only had one reopening in March, we've had 2, where things are, and that gives people just like, we're ready, we're hope, it's okay, we don't have to worry as much anymore. There's this like sense of relief. Like we're going back to normal. It's fine. I can go do whatever it is that I want to do and not necessarily worry. Right. Unfortunately, at this point, I think we have worry. We have a reason to worry. And when the governor opened things or relaxed things back in the beginning of March, I was like, can we just like wait one more month? Like I was like 4 to 8 weeks and we would see a different pattern, like just to get the vaccinations going is like, can we wait a little bit longer? But he didn't. So for whatever reason, we're just now chasing. We're like, which is going to go ahead, the variant or the vaccine?
This is no longer rocket science. This
Right.
is pretty straightforward stuff. So to cut to, as far as I'm concerned, Katrina comes in and presents her material every week. And she is supplying now with stuff I think we've seen elsewhere, and she just did a great job bringing it all together. I realize we can't do it tonight by open meeting rules, but I would like to, I'm asking our committee, our group, to get together before our next meeting, not before our next meeting, but in time for our next meeting, and seriously consider a local order after examining the opening, shall we say, the formulaic openings that the governor allows for the state, to see which one of them we should, shall we say, roll back or put a pause on until such time as, shall we say, the beginnings of, till we see a deflection downward, not just a flattening, but a deflection downward. Because I have no illusions about its, quote, its potential effectiveness, because it would require, and I'm sure that Katrina would, I hope she would agree with me on this. If we do it by ourselves, it's going to be very tough to see an effect. But I think I'd like to put out a pretty firm signal to our friends and neighbors, as Katrina said, it's not over. It's not over. We're very close to being over. I just don't like to see our town, after going through what we've gone through, very luckily with a minimum number of, unfortunate and some, frankly, unnecessary deaths, to start another cycle, especially since we have a very vulnerable population sitting there waiting for the virus. Because with the vaccines and also the age distribution of what we can already see in the rising number of cases, it's crystal clear. So if Katrina showed at least 2 graphs tonight, they were very graphic. October of last year looks like where we are now, just before everything took off. And the same reason, as she pointed out, after a couple of weeks after an openings. Now, I'm not trying to lay this at the governor's doorstep. It's also people's behavior, the relaxation of behavior. And I feel that the signals that we put out, pleading with people to wear masks and do the other stuff, is not as effective as saying, look, we're going to tell you, you can't do these kinds of activities, especially those that are very obvious and involving the targeted, shall we say, the most vulnerable age group, which happens to be from what we'll say, 19 to 35.
Yeah, I think we can discuss it a little bit more, and I think ask Jim his advice, because
Well, I'd like to go further than asking Jim, because Jim is not the epidemiologist. Okay,
well, Jim had the information on how we would do it.
that's true, but I
as a local board.
yeah,
So-
what I'm less interested in at this moment is what is the how we want. In other words, I think we first have to understand what the restrictions are. That is what the current stage that we're in. And then we can move for that pretty quickly and then definitely consult with Jim. This is what we wanted to get done. How do we do it?
Okay, Kevin?
Mike, could you put together a very brief and concise synopsis of what you just recommended the board consider? So we can all just.
Yes. Well, I don't want to break open meeting rules.
Nope, just
Suggesting that I'd like to see by the next meeting that we have looked at the, shall we say, the current phase and what is allowed and what's not allowed under the current phase. And among them, select those that we feel will have an impact on mitigating as much as possible further number of cases in town. Period.
I can ask Jim to be really specific about what phase we're in. And look at.
Katrina, could you comment, please, on which of the current restrictions, which of the current, shall we say, relaxation steps?
there you go.
Which of the current relaxation steps are the most encouraging, that are more than likely in the age group, especially of interest to us, more than likely to enhance possibility of transmission?
So I think I know where you're going with this, Mike, and I'm struggling to figure out which one to target, because I think it's all of them combined.
Yep.
And if you're talking things like where large numbers of people gather for long periods of time, like the schools have put together all the mitigation, they've thrown everything they can at it. And so I don't think, and that's important education and other things. So I don't think you can touch the schools. I actually would encourage you not to. And then the other part of this, so things like capacity limits on restaurants and gyms and our local businesses.
How about
you could
outdoor-
roll back those things, but then if we're neighboring towns who have the same things, and people are just going to leave to do it. So I hesitate to be like Littleton's going to make a big impact by doing anything singularly unless there's a broader.
Do you
Board of
think
Health
do you
Coalition.
think it would send a signal to at least our residents based on what you've seen? Do you think it would send a signal to our residents that things are not over enough for them to go doing what they're doing? Or do you feel it'll be simply ignored, they'll just go to Westford?
I think you will have a group of people who have been paying attention and will listen because that's what they've been doing. And then there's a group of people who will just go to Westford. I'm honestly out at this point. I want to be like, let's shut down Littleton. Like, let's just clamp it down. And what I think you're seeing is schools are opening, people are going back to the office. Like there's broader openings, and like the traffic on 119 when I went to take my son to school the other day was like rush hour traffic again. So I think there's more things happening now than there were in the last past surges. So I'm not sure how like a capacity limit on a restaurant's really going to help us right now.
Okay.
I'll try to think of something. But I think there's a broader set of things happening that we don't have control over. I mean, honestly, if there's something I want you to focus your time on, I want you to figure out who those 500 people 60 and above who haven't accessed vaccines yet are and what the barriers are for them getting vaccines. Like, can they just not operate a computer and need someone to make the appointment for them or someone to drive them to an appointment?
Well,
like-
I think it's pretty well understood how it breaks out,
Yeah.
especially among the elderly.
Okay.
The
Well, I know the COA
cranky
probably has
elderly.
something.
What?
On it. The COA and the
Yeah.
DHS probably have some clues into that, but I don't know. It's really, if you could just bring some vaccine to Littleton, I'd feel better.
We'll right on it.
Please bring some.
Louise, did you have something you wanted to say?
I was just going to mention rolling back the restaurants, but Katrina already touched on it.
I mean, it's something we could definitely do. With restaurants in other towns around us not having capacity limits, I just see people going to the next town.
Yeah.
And it would just hurt our businesses.
Yeah. All right. Well,
I know Mike's mad at me now.
No. That's why I brought it up. If the committee, if our board feels that this is a hollow gesture and, won't have the effect that we're after, if it doesn't send a signal and just makes it, useless.
Is there other ways that I know that in the past you've had, at least through Anthony, there's been some press releases that have gone out townwide via the email system about just reiterating good, like in the December timeframe, there were some that were cases are on the rise and be careful and here's how you get your vaccine. And can we revisit some of those messaging systems that we had over December? I know LCTV had been putting out some stuff for a while on Facebook. I'll keep posting on Facebook, like trying to get into the groups.
Yeah, the kind of stuff that are the other signals that worry me. For example, I know that now that the weather is warming, I'm seeing more mailings from Park and Rec, for example. And I know that they're very anxious as long as library, and I'm not trying to pick on the library and Park and Rec, but there are organizations, including those that want to get people together to have kids play basketball, soccer, whatever. Okay. I'm not talking about school stuff. I'm talking about outside. And, I'm not so much worried. I am worried about the kids, but I am concerned about the spread among the parents, as it were. And the, still young grandparents, whatever. And it sounds to me like what you're saying quite correctly is that we already have established there's a certain percent of the population that pays attention. Then there's a certain percentage that does not. And that's the way it is.
And when you're talking about things like the youth sports that are spring sports that are approaching, and I know Park and Rec has mitigation that they use in all of their programming. And it might be good to have some outreach to those groups just to remind them how dire the situation is right now. And there are sports clusters. There's a large increase in sports clusters in our case, large number increase of sports clusters in our state. And that is happening in baseball and football and lacrosse and something else recently, basketball.
I think basketball is another, hockey and basketball are the big ones.
Yes, but even more recently, football and baseball.
Yeah.
This
And
is
lacrosse.
the conversation you and I had, Mike, about, some folks just don't want to participate in the testing program. And that's.
But it's not even just that. I feel like with the youth, with the youth sports reaching out to the leaders of those organizations, if there's a way to connect, for you guys to connect with them and say, hey, this is really important for you guys to really be good about the mitigation right now. Like we recognize that you're using it, but just make sure it's happening. That might go a long way. That might have some weight of like, we recognize you're going to play, we recognize you're going to do it well, and you're going to use all these mitigations. And when there's an issue, we're going to have to talk again, like that. There'll be no one really wants an outbreak in their activity, to be honest. So
right.
Most individuals in town who are leading those things are trying really hard to use every tool in their toolbox to prevent a spread in their group. So again, I think that that's a great letter to write and to help spread the word to, trying to get to the leaders of those organizations so they can share it with their coaches and their teams and the individuals involved. And at that point, if your kid is participating in these kind of sports things, it's even more important as a parent to be modeling good behavior, doing it, and trying to minimize contacts where possible.
Kevin, are
lucky,
any,
and lucky for us, the B117 is what, half?
55.
55%.
I see a lot of cars at Castle in the Trees now. It's the beautiful weather's coming. People want to.
Yeah, I mean, the good news is those outdoor venues are much less likely to have a lot of spread in them. They're not indoor facilities. And every thing in Massachusetts has a mask order, like a mask requirement, except for swimming. So
maybe we should remind them of that.
Yeah. So I do think there's just being outside and having that mask order and then keeping distance wherever possible is those three things will go a long way to preventing issues in those groups. But again, like team rosters, each time that a kid, every practice, every team, every game. So if there is an issue, have a contact tracing list you can go to say, oh yeah, so-and-so was there on Thursday and these were all the kids who were there in the 2 days before that, those kind of things are really important. And I'm not sure how each group does record keeping, for example, to help contain spread should there be an event. It's just, and then we keep talking about the school committee. There's a whole group of people who get reached via that group who keeps talking. I think a townwide email, if you can get Anthony to help with that again, would be a good way to blast a number of people.
I'll contact Anthony and see if we can do just another reminder, not to relax your mitigation and just continue with the mask and social distancing and vaccinating. And I will call Council on Aging and see if there's anything we can do.
And definitely
I will not rent a bus.
And definitely put a reference into group activities.
For the press release with Anthony?
Yeah. Especially, outdoors or indoors. So I'm thinking of the sports that are, whether they want to admit it or not, basketball is a contact sport. Mm-hmm. So it's baseball and the rest of them.
Right.
Yeah, it's definitely a good time for groups to look at their mitigation strategies and really recognize now that they may have had success in the fall, but we were very different levels of COVID and situation in the fall where parents were essentially at home and kids might have been doing the sport, but the amount of contacts each of us as an individual had were much lower then than they are now. And we have a higher rate of COVID and it's the variant, the UK variant that spreads really easily. So I appreciate every person who made it for a safe every season, every anything that has happened in the past, but you treat this one like a new season as if it's fresh and just realize that it's more likely to happen now. And even if you don't have a case, you're more likely to have teammates who are close contacts and have to quarantine. So especially with the schools being open. And if there is a case in the schools now for K-8, you're going to have close contacts in the schools who suddenly have to quarantine. And there's going to be a different dynamic over the next few weeks than we've had up to this point.
Kevin, do you have kids that do youth sports, soccer or anything like that?
In a few weeks they will.
Yeah. So wondering, what is it? Littleton Youth Soccer? What do we have? Baseball? Littleton Youth Baseball?
Soccer, baseball, softball.
Lacrosse.
Maybe we should reach out to all of the heads of those departments and make sure that they have contact information for each kid and strongly suggest pool testing in the schools and
soccer folks are all over it. The baseball.
Yeah, I do agree with what you just said, Lisa, that if you can convince, if these leaders of these sports could be good advocates for every kid to participate in the pool testing in the schools. It not only makes the schools safer, but it will make their sports safer.
And their season more successful.
Exactly. Like
yeah.
As a community, we're going to be increasing our success rate because we'll be keeping cases down. So
I even meant beyond, we're talking about kids in sports, have their teams be successful in their particular sport. And
absolutely.
COVID, yeah.
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 I mean, I think I can help you connect with some of those. I think Kevin actually and I probably cross on many of those things we just listed, but we can probably help you find the people if you need to, who's leading what.
Kevin, can you take a lead on that maybe, or?
Sure.
We still want to get after the 25 to 35 or 46-year-olds. They're the ones.
Well, our population of 20 to 29-year-olds in town is very small. 20 to 29-year-olds, sorry.
They don't want to live here.
If you can get through the kids, you might get to the parents of the kids. They'll be hitting that 30 to.
It's the parents that I'm worried about, or not worried. I'm trying to target them.
Yeah, I think that's it's an important point. Like through the schools and through these youth sports, you will connect to a large portion of our community because of, the kids are 24% of our population, and then the parents are another 50%. So
should you be able to convince the head of the soccer and baseball and softball contingent to involve the players in a pool testing program? What does that look like?
I think you can't require it. I think you can encourage them to support people.
And impress upon them how it will keep their seasons lasting longer, because they'll have all their kids, making sure that they have contact for parents, and in case they have COVID, because somebody on the team comes down with COVID, and like we said, advocating pool testing so that they'll be healthier and they'll be able to play. Because if they're asymptomatic when they're in pool testing.
I'm still trying to get at the parents, and I'm just wondering, is the message getting garbled? I do understand about the desire to increase the number of participants in pool testing, but I'm wondering, does an explicit statement or a message to parents of the kids playing these games that they, as parents, should continue doing what they've been doing and more, to make sure and point out to them that it's their group that's being targeted by the virus and that they're susceptible to the surge. That is, they're the prime targets for the surge. It's not the kids.
Right.
It's
also making sure those leaders of those organizations make sure the parent, what do they have? There was one group that we're only going to allow one parent at each game, kind of thing, and making sure that you can have two parents.
Yeah, I don't know what the limits are this year, but I know in the fall soccer only allowed one parent on the sideline, no other family members, just one person.
Yeah, and making sure that those parents.
And they were all distanced, and they were all really good about distancing.
Good.
And everyone wore masks.
Yeah.
Players and.
They've done a great job.
Yeah, that's just remind them that should still be in effect.
Mm-hmm.
The other thing, because these groups have an audience of adults, it would be great to remind them when they can get vaccinated, and that it would not only protect themselves, but it would help protect their families and spread even among, like I said, in Israel, they got to like 50% fully vaccinated in all age groups that were eligible, or most of the age groups that were eligible. And just the cases among the kids just dropped. So who weren't eligible for vaccines yet. So if we could encourage these community groups to encourage their players to opt into the pool testing as the students themselves, and encourage parents to access vaccines when it's their turn, we could very quickly, within a couple months, have a different scenario, which would only set us up better for summer.
Yeah. And you said it starts in a couple of weeks, Kevin. So that's around in April 19th, isn't that the day that it opens up to another age group?
The last age group opens up the 19th. Yep.
Yeah, so right during soccer season, spring sports season. So
Kevin, the other thing you can remind people is that clusters have been seen during carpools and just when people let their guard down and play as groups of people, if those post-game celebrations and things like that.
So they're not doing the snacks anymore at soccer.
Right.
They've taken a lot of precautions to make sure that they're doing the best they can. Only two parents per player. I actually was just texting with Bobby Crench, who's the head of the Littleton Youth Soccer and Baseball organizations. He's in the middle of a board meeting right now. He can't jump on the call, but he doesn't think it's going to work to get everybody involved in the pool testing program that's involved with the youth soccer program. But we can certainly put out a PSA and let them know how important it might be. Just as a side note.
Well, you need to impress upon him how important it is.
I will.
All right. Okay. Thanks, Katrina. Anybody else have anything else? I know, Mike, you want to, okay.
I'm sorry.
I'll talk to Anthony and I'll talk to Council on Aging this week.
And also Park and Rec, if you get a hold of them.
Yep. And then we'll rent a bus and we'll take 500 elderly down to Foxborough, right?
They still won't go.
Is it, you think it's apprehension or?
Dino drives.
Do you,
That'd be all right.
do you think it's apprehension, Mike, about the vaccine and how it came about so quickly, or are they afraid to go to, it could be anything. They can't get a ride, it's not local.
It's a mix. It's a real mix of at least 10 items. I mean, it's not, I think if you said, oh, we'll come to your house, I think the numbers would be cut probably in half.
Right. Yeah.
But not because they're lazy or it's just that it's, I guess you reach a certain age and I don't know, if the get up and go isn't there. I don't know. I don't know the answer.
Yeah.
I'm the wrong person to ask, obviously.
Right.
Well, I think maybe Ashley at this EHS, hopefully she has some ideas, because if there's a way that, they just don't have computer know-how, well, let's pair them with a high schooler who needs volunteer hours and have them sign them up for vaccines or
Good idea.
Or somebody needs a companion. So if suddenly we have a companion vaccine going down with an elderly who can help them to Gillette or something. I don't know. There's, and even if it's just a conversation, like they just want to ask questions to somebody who they trust, that would be great too.
Okay.
I'll talk to anyone about vaccines.
Okay. All right. Questions, concerns, comments about COVID? All right. Anybody in the audience at all? Put their hands up.
No hands are up, Lisa.
Okay. Thanks, Janet. All right. Thanks, Katrina.
Thanks, Katrina.
Thank you.
All right. And then the next on our agenda was discussion supporting the Board of Health, supporting the school committee.
Yeah, I think that was specifically supporting their ongoing effort for pool testing, including increasing the number of opt-ins.
Mm-hmm.
I think just keep it simple.
Yeah.
Especially now that they have extra funding now, or funding to take.
Yeah, it's going to continue to the end of the school year, which is awesome.
Yeah.
And I think Mike Fontanella was talking about how maybe that things might change a little bit more now that the kids are in 5 days a week. So I guess every cohort had an opportunity too, right, to get tested. So, all right. Yeah, I support it. Go ahead, Kevin.
I mean, I think the one thing we can do to help to help the schools is to help provide nursing and assistant support for the testing, so they're not overburdened in the schools.
So you
Whether
think,
it be, volunteers or, folks in the community that can step in for an hour every couple days and, visit one building and just make sure all the tests get done appropriately.
Have there been any reports that my understanding is the staff has been able to keep up and they've got a pretty slick operation?
I think they have been. I think they've been doing a great job.
Yeah.
But
we should try and see if Alex McCurdy's group can volunteer or anything like that, or
You need to have certain amount of training and background to provide the injections.
with the HEPA certification.
okay.
There's a lot of folks in town that would, I'm sure, willingly step up. Even, the folks that came in front of us to try. What were they?
They were putting together a company.
Yeah.
To do
Yeah.
testing.
Andrea.
Even those folks, I mean, they have kids in schools. I'm sure they would be, how Littleton is. I'm sure that they would step up and do whatever they were asked to do in that regard. But I think
Well, I don't think it's a secret that the schools are doing opt-in surveillance testing, especially if with people who, have a background in healthcare, even if it is indirect. It's not a secret.
Yeah. I can't imagine, Kevin, you have kids in school, and Katrina, I can't imagine the emails that you guys must get from the schools about opting in and this is happening. And well, your kids are remote, Kevin, so, but they must just be, Katrina, you guys just must be inundated with emails from the school about opening and what the options are. And
There's been a lot of communications lately.
communication.
We get a lot from Dorothy.
So, if who would we contact? Is that Lynn Snow? Who's kind of in charge of the testing?
Lynn Snow is heading up she's like the person to contact for testing. She's great.
Yeah, I know. Yeah, I watched her.
She understands data. She gets data. She's the one tracking all of the symptoms and things, just to see like number of times kids go to the nurse's station, and like trying to see if there's an early signal they can kind of catch. She's great.
Does anybody, Louise, do you want to reach out to Lynn Snow at the school and see if there's anything that we can help her with to add? Sure. See if we can get any more kids to opt in.
Sure, I can do that.
Support that. I saw her presentation when they were proposing the pool testing, and it was pretty impressive. So
she gave a really nice rundown last week.
Did she?
Last week too, of everything. Mm-hmm. So there's a really detailed slide kit she went through. It was great.
Yeah, I think the idea is for the Board of Health to try and assist the school committee and assist the school community in trying to just get through this and see what they need so we can help them do the best they can.
Do you think a message on the signs that are up in town, try pool testing, or get your kids signed up in pool testing?
Well, I really liked Louise's idea of giving the players the game ball who are participating in sports. But I think what goes a lot further is a $10 Kimball Farm gift card.
Wait a minute. We're going to give them a ticket to go out of town?
No, to get an ice cream cone.
We're going to Menchie's.
To spread the virus.
Well, okay, Menchie's, whatever it takes.
Yeah. I think is Justin McCarthy on still?
He is, yeah.
He had some great ideas too.
Yeah, Justin was talking about some kind of incentive to get kids signed up for the pools.
I think his wife's on.
Allison McCarthy's on. Do you want me to allow her to talk?
She's allowed to talk, sure. But that might be Justin too.
You're muted.
Allison, did you want to talk, or is that Justin? All right. Maybe she's off for a reason.
Yeah, before we go much further, do you actually want to put together a statement of support of the school committee in their efforts to continue pool testing and to increase the number of folks who opt in and make it
Absolutely.
simple?
Let's get to 80%. That's what we need to do.
Do you want a specific motion so that we can move on?
Sure, go ahead.
All right.
Can we do that?
Way with words, Mike. So why don't you just
Can we do?
No,
Put it
no,
right.
actually Louise is the one. She can
All
be
right.
brief and express.
All right.
Hold on a minute before we make a motion.
Yeah, I don't know what we're doing right now.
Is that cool to do? Because the last time we made a motion that wasn't in a public, because this is just a discussion on our agenda. So is that okay to make a motion?
Sure is.
Okay. I don't want to violate any open meeting laws.
Snowball.
Not on the agenda. So Janet, do you know? Can we take a motion to make an announcement that we support the school committee? Or is it just?
I think if you're just making a statement, that's fine. I mean,
All right.
you're not imposing anything on the school.
All right. So who would like to make the statement? Do we just say it in the meeting, or do you want to post it on our website?
Whatever we decide to do, we ought to communicate it to the school committee and to the staff that we support their efforts to continue and to make effort to increase the number of folks, number of students and staff who participated in pool testing.
Exactly what Mike just said.
So moved.
Okay.
Can we send out like a mailer, another mailer for the school families to get, but like from the Board of Health, that we strongly support the school committee, the schools, and you know what I mean? From us.
I like what see, this is why Louise is good. Fantastic. Good idea. I think.
Because we don't send them anything.
Yeah, and that email blast, I think would be a very good idea.
You're going to do better with an email blast with this crew that we could then cross post on Facebook and put in the principal letters and.
Yes.
All right.
We're trying to send it to the town. Okay, not just, yeah.
Okay, so sending just an email or a flyer.
An email.
Okay. So that would be
Need flyers anymore. I think they're just doing emails now.
okay. So would that be through town administrator? Through Anthony?
No, it would be through the schools.
Through Dorothy.
No, we're trying to reach everybody, not just
Everybody in town. Is that what you have in mind,
okay.
Louise?
No, I was thinking the schools.
Okay.
Because those parents are the age group that we want to target, right?
Right.
Well, we want to target everybody, but if we're supporting the school committee and asking for more people to join the pool testing, that would be the school community.
Yep.
Even though we want adults at that certain age group to start to continue to be careful too. But right now, the discussion is the school committee is supporting them in their pool testing. So it would be school, I think. Yep.
So it'd be schools. Okay, that makes sense. Okay.
You could do both.
Yeah,
Yep.
I would do both.
we could do both.
I would
yeah.
vote. Yeah, I think we ought to spread the word about this, what we're encouraging.
Okay. So talk to Anthony, talk to Dr. Clenchey.
Who has the
Dorothy.
list? Who has the
Dorothy.
mailing list at the schools?
Dorothy is the
Okay.
admin there, right, Katrina? Okay. And then Anthony also.
Maybe we should write it up so they both say the same thing.
Mm-hmm. Yep. So the Littleton Board of Health strongly
Supports.
supports the school committee's actions.
Recommendations for pooled testing or
Go ahead, Mike, give me some words.
I think what we're strongly supporting are their efforts.
Efforts.
In pooled testing and their ongoing program to enlist more folks to participate in pool testing.
and that we strongly recommend they continue with the social distancing and mask wearing because of the variants are becoming
good.
very active.
Thank you, Louise.
You're welcome.
Continue to recommend mitigation practices.
Continue, right?
Strongly urge.
Strongly urge you continue all mitigation efforts.
Because we're seeing an increase.
Yes.
Vaccinate when you can. And social distancing and no large groups. Okay. All right. So the Littleton Board of Health strongly supports the school committee's efforts for pool testing and ongoing program to enlist more families to participate. We strongly urge you to continue the use of, I can't read my own writing, all mitigation practices, including mask, social distancing, vaccinate when you can. That sound good? What? No?
So moved.
Can you read it again? Sorry.
That's all right. The Littleton Board of Health strongly supports the school committee's efforts to in pool testing and any ongoing program to enlist more families to participate. We strongly urge you to continue to use all mitigation practices, including mask, social distancing, vaccinate when you can, and vaccinate when you can. We can tweak it if you want to work on it, but that's basically the idea.
Yeah.
Okay. I'll work with you.
I just think we need to encourage more participants.
Mm-hmm.
You know, we need to get to
We
more.
could say we're at 60% now. We're trying to get to 80% in the pool testing.
Ice cream goes a long way.
Frozen yogurt.
Froyo, ice cream, whatever you want.
Oh, Menchie's. I think Menchie's is frozen yogurt.
Oh, to keep them in Littleton. I get it. Yeah.
I hope that wouldn't help continue the spread, though. Having all those kids showing up at Menchie's up there.
Did you see Kimball Farm the other day? It was jammed. It was line was like 20 deep.
Unbelievable. All right. I'll work on that statement with Louise, and I'll send it out to you guys for approval before we send it to school committee, Dr. Clunchy, and Anthony. Okay.
Sounds good.
All right. Next is the correspondence about the mosquito control project, and I think we didn't need to even respond to that, correct, Janet? They just send that out to let us know that we're part of it and that the price is going up. And
each year you vote to support it and to recommend to the Board of Selectmen to support it. And then I pass it on to the town administrator to vote and choose whether they're going to pay the funds.
okay. Does anybody want to make a motion to recommend?
I'll make a motion to support the mosquito control project for the town of Littleton.
And is there a second?
Second. Mike Sheldon, second.
So we'll do a roll call. Kevin Baker,
Yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Sheldon, yes.
and Lisa Flanagan, yes.
I must note, apparently we have a motion, we passed a motion for mosquitoes, but somehow or other COVID doesn't make it. Okay.
Didn't make it. No one asked for a second.
What irony
Oh,
is there in
I
that?
think we all agree that we're supporting the school committee.
No, I know it. I just find it
But
amusing.
I don't know
That's
if a motion needs to be taken, Mike.
all. Well,
Politics, Mike.
no, it's
Politics.
mosquitoes. It's mosquitoes versus the virus. It always is every year.
Mosquitoes cause virus.
They cause other viruses. We don't need more.
Yeah.
Wait a while. Yes.
Okay, and got some meetings, the minutes from January 27th and March 24th to approve. I get a motion to approve those.
Motion to approve.
Thanks, Kevin. And a second.
Second.
Thanks, Louise. We'll take a roll call. So approve the minutes for January 27th and March 24th. So Kevin,
Kevin, yes.
Louise,
Louise Nichols, yes.
Mike Zeldin,
Mike Selden, yes.
and Lisa Flanagan, yes. All right. Any member comments? Nope. Okay. And any public comments?
No public comments.
Okay. Next meeting is next Wednesday. So I'll make all those phone calls before next Wednesday and talk to Council on Aging, Park and Rec, and Anthony. And then Louise and I will work on that, the school committee, the supporting the school committee efforts, that statement from us, so that we can do a town and school email blast. So I'll do that before the next meeting, and that will be the 7th.
No, the
Yeah. And the only thing that I'd like to just put in before we fade to darkness here is that if we can sneak in a reference to the fact that the number of cases in town and around us are going up.
Yep.
yeah, that's good.
Yeah, sort of give a sort of a foundation for why we're emailing to people.
So because cases are increasing
Yeah,
again,
cases, yeah, not enough of are vaccinated yet. And things are, yeah. Just put in those two facts.
Fourth wave, et cetera, et cetera.
Yep.
all right. Has anybody heard from Gino? No. Okay.
I thought
So-
you might have, Janet.
No, I have not heard from him.
All right. So I need somebody to make a motion to adjourn. He's not here.
I'll make it.
He's usually the one that does it.
I'll second Louise's motion to adjourn.
Okay. All right. And roll call, Kevin Baker,
Kevin Baker, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Selden, yes.
and Lisa Flanagan. Thanks, guys.
Thanks, guys.
Bye.
Nice to see you all. Good night,
Yeah.
Janet.